No, it has not. I mean, he's the same, so he's just gonna change overnight?
No, what we're saying is what we are witnessing. That is what we were saying. We were not in your home, so we don't know. We're taking your word, but we're also saying right now, these are not the behaviors that we're witnessing while he's been here in our care for almost 2 days.
It would not, if it was not significant, your nurse would not have stated, does he do that all the time when he goes to sleep? This was not just, oh, does he do, he was concerned about the jerky movements he was making when he went to sleep. It wasn't it just happened.
Yeah, people do that sometimes when they're falling asleep and sometimes when they're waking up. It's
I'm
all
just telling, that was a
different body.
qualified, one of your qualified nurses asked me a significant question, and he didn't just do it casually to say, oh, does he just do that? He did it because he was concerned about those movements. And I asked him, I said, can you please document that, because this is exactly what neurologically, and you guys are not going to admit it because obviously there's a flag in the chart or something saying do not admit to a neurological status. Obviously,
We don't
because you
have
guys,
any flags
okay,
in there.
sure, okay.
So
I know that happens. I know it does.
we don't
'cause
do
I'm in
that.
it. Okay.
So that's your belief, and I am gonna talk to you about respectful conversations.
We are
because-
having a respectful conversation. I'm not yelling at you.
Nope, I didn't say that, but we also have had a couple other conversations that haven't gone that way, so.
When was that?
Sounds like earlier today, we've had a couple,
And did I yell at somebody?
and yesterday. It's
Did I
not
yell at
about-
somebody?
It does, Nadine,
I'm
I'm
asking.
not asking and talking about you yelling at someone. I'm talking about a respectful conversation. We are here to care for your son. He is the patient. If you can't have a respectful conversation on the phone or in person, we will ask you to leave.
Are
That
you
is our route.
respecting me right now?
Absolutely.
No,
I'm
you're
telling
not.
you the expectations.
You're
of
telling
the-
me you're gonna kick me out because I'm asking you questions and I'm talking to you.
That's not anything that I said. I'm reminding you that we have a respectful workplace environment.
I can pull
And
all
I'm
those audio
asking you
conversations.
to be respectful
And
to
that's
me,
another
just
thing.
like
You
I'm.
recording without telling people you're recording is not okay. You need to.
That's a
inform people
one-party
that you're recording.
state.
You need to inform.
It's
because
a
people
one-party
here have to
state, and
consent.
what I'm saying is, because I talked, this is why you guys wanna get away with this. Because you
Get away with
know
Get
that
away
if
with
I,
what?
because you can't deal with somebody recording because you know that you're gonna say things that are against what we say. You wanna be in control.
That's not
This is a
respectful.
narcissistic view of the
That's not
AMA.
respectful
So
to
I'm
record
just,
someone
what I'm
without-
saying is I'm trying to be respectful for you, and I don't have but if you guys can't be respectful and let me know when you're administering new medications,
We
I don't
haven't
know what to
administered
say.
any new medications. I talked to you yesterday and you declined the Geodon and you.
Risperidone is not something he's taken.
Geodon. You-
Risperidone is just not nothing he's been
That's,
taking.
that's just a PRN medication.
Okay, but I'm just saying, be respectful. If you're gonna, if you're going to put my son in restraint, or you're gonna give him new medication, it's just obvious that you should probably call a parent and say, hey, we're gonna do this.
We don't have the capacity to do it in that moment, so
They'll
we
tell you
will manage.
afterwards.
Yes, they will tell you afterwards, absolutely.
Yeah, I
They will do
called and
that.
they told me.
And that was a gap for us. We should call and let you know once the situation has been settled. But we will not do it in the moment.
Because it was hours before, they told me it happened hours
And I just
ago.
said, as you heard, that was a gap for us. We should have called you as soon as we had the capacity, the situation was handled and calmed down, we should have called and let you know. I
Okay.
just told you that.
So I just wanna
But we
know.
will not do it
And
in beforehand, because we will have to manage to make sure the whole milieu and your son included is safe. We
Okay.
can't have him pounding a hole through the wall that's unsafe for him.
He's
Same
profoundly
thing.
autistic, and this is what I told your staff. You can't punish him or do anything like that because he does these things.
There's no punishment.
Like I said,
This is not a
It's just
punishment.
whether you believe it or not, he has a neurological problem, and he gets into these and then he cries.
But we
You've seen
can't
him
let
crying
hurt
too, because
himself.
I know I talked to you guys about his crying.
Okay.
This is
We can't let him hurt himself,
Or
Mhm.
or our staff.
I get it.
Those are our biggest
Mhm.
things. We're here to take care of him, our staff, and the rest of the patients that we're here to serve. And that's what we have to do. Those are where those PRN medications come in,
Mhm.
to make sure that he stays safe and that we're not injuring anyone,
Okay.
including himself.
Yep, I understand that. But if you can let me know when I was disrespectful, I'd like to know those
In your
Those times.
conversations.
Okay, so
Yesterday,
when?
earlier
Yesterday?
Today,
yesterday and earlier today.
On the
Okay.
phone.
on the phone.
Okay, we will get those conversations and-
I don't need to hear them.
I don't care. You're
Person.
telling me that I was disrespectful. I'm gonna pull those and see if I was disrespectful, okay?
That's good, okay.
And then we'll bring
I'm
them to
just telling you, I
somebody.
don't need to hear them.
Okay,
I
you don't
need
have to hear them. I
that's
can take
fine.
them to
and
the
I said
ombudsman or something,
I'm-
because you're telling me I'm disrespectful, because I'm bringing up things that are, all of you are ganging up on me.
Absolutely
And
not.
literally telling me that I'm disrespectful when I haven't been. You're going by word of mouth and you haven't even heard the conversation.
I'm going with my trusted colleagues here. So
Right,
that is
right,
the
right.
support
You're
that
gonna go
I'm
by,
going to
like,
do. Just like I'm here to
hearsay.
support your son. That's why we're here taking care of him.
But I was
Mhm.
present for 2 of those conversations, and I could hear you being loud, and you were also, you said to Haley, why the fuck aren't you taking him to this procedure
I don't
tomorrow?"
curse, ma'am, you're lying. I'm gonna bring that conversation to your face,
Stop.
and I'm gonna bring this conversation to the
You shouldn't be
ombudsman,
recording.
and I will,
Because you didn't-
I will
you didn't
bring
notify
this
me.
up. I have every recording we had. So you tell me when that was, ma'am. You're lying, just like you guys
Okay.
do in the AMA,
Nadine,
okay?
Nadine.
I'm telling you that you're lying.
This is
I
being
don't say that.
disrespectful right now.
You're lying you're
I'm
lying.
not lying.
You are
made it
lying.
clear this afternoon with
I
you.
don't curse, ma'am.
But
I don't
you're-
curse.
Okay.
I'm a Christian. I don't curse. So you can't go there with that.
You also
Why
said
are
it
you
was
lying?
Yesterday evening.
Why are you
I'm
lying?
not lying, but
I said the F word?
I said you yelled at Lucy on the phone yesterday evening.
You just said I said the F word.
That was to Haley today. About
Right.
the procedure.
And you're lying. I don't curse, ma'am.
Okay,
Anyway.
I don't
let's
curse.
move on.
okay.
It doesn't slip out of my mouth.
We're done
Okay.
with this part of that conversation. I was just
Your
trying
doctor is
to-
sitting here lying. And I'm gonna bring this up, man, because I can't believe you just sat there and
Nadine,
lied
Nadine, we're
and
moving
said that I
forward.
was cursing when you got the problem because you're a liar.
Nadine, we're
So now
moving
this is gonna be
forward.
retaliation. You'll probably treat my son bad, and you'll probably,
Nadine, we are
yeah,
medical
oh goodness
professionals.
gracious. Yeah, I know you are,
Okay,
just
so,
like Riverside, just
about
like
respect-
everybody else. You go with people like CPS and you treat well parents like crap, okay? And you do whatever they say.
Ma'am, we serve the most underserved population in
Sir,
Minnesota.
do you forget I worked in the medical field,
okay,
okay?
so.
And
if
then I
you-
found out
I
what you
understand.
guys do.
Okay, so if you had care at these other places, why are you not having care still at those places?
Because they won't let me visit my son. They do things to break state requirements. There are state statutes that they're breaking. They're committing fraud. I have all the evidence. Okay?
So,
I
just
need
wanna
help.
get to the point on.
I need help and
Tuesday
nobody
at-
will address the neurological issues my son has. That's why.
Okay, what we agreed to is.
He
we are
needs
going
neurological
to-
help.
We're going to change medications. That's what we can do. We can do med management. So, just like, Dr. De Leon, she talked about the meds that she's going to, we're gonna start giving to your son. That's what we're gonna start with. He's not gonna have that procedure done tomorrow from us. So if you want that procedure done, you are welcome to take him and do that. He will be discharged, and then you can take him to that procedure.
I'm
And
sorry.
if
Say that
you-
again, what
if
you just
you-
said about discharge?
He would have to be discharged, because
Okay.
we're not going to do that. We're not gonna do that procedure. If you want to continue to come see him, and we would enjoy that, and I bet you he would as well, he would support that and want you there, you are gonna be respectful to all of our staff. Otherwise, we will have you escorted out.
Yeah, and then you will be respectful to me.
I have been respectful to you. I have
No, you
not
haven't. She just said
disrespect-
I cursed.
I have not disrespected you once. She did not disrespect
And
you.
you're
She
calling
just told
us-
me I said the F word.
And you're telling me that.
You're
I'm
putting
the one
words
You're
in my
telling
mouth
us
trying to
that
make me
we're
somebody I'm
lying.
different.
I did not call you a liar. You called us a liar.
She
We're
just
a
said
part
I
of
said
the
the F
team.
word and you didn't hear that because it didn't happen. How am I gonna look at you respectfully when you just lied? Really, how do I trust you now that you're not gonna go back to those medical records and commit fraud just like all the other
'Cause we
providers
don't do
did?
that. We don't. So,
Other doctors said that too, right?
we're gonna move forward with the med management, if that's what you want. That's what you agreed to, so that's what we can commit to.
Okay, well, I'm just saying, you know, if you could just please let me know when you're changing, or if you're doing PRNs or anything. I don't, I'm trying to look for,
We
look, I
will.
want my son to live as long as he can.
Absolutely,
You
we
know,
want
I
that
don't
for
want
you
him to be
too.
a statistic.
And once the situation, if we're gonna give any PRN meds, we already talked about what we're gonna do for the home medications that we're gonna change. You wrote those down. We're gonna start with that. If we give any PRN medications, it's in the management of the time to make sure that he stays safe, the rest of our patients stay safe, and our staff stay safe. After that situation is calmed down, we will call you and let you know that this is what happened and this is what was given.
And could you tell me what was disrespectful that I said?
We already went over that and we're
No, we
moving
didn't.
forward.
No, we didn't.
Yeah.
I didn't say
I'm-
the F word.
Okay,
And-
we're not gonna keep.
So
going
is
in
it
the cycle.
disrespectful to question you about medications or to talk?
We're not talking about that.
We're talking about the phone conversations that you have with the MHCCs.
I asked for a name. I asked for a full
I didn't say anything
name.
about that conversation.
Okay, what I'm saying is when I talked to Haley, I asked her for a
We
name
don't
and
have
she
to
gave
give
me
you our full
initial.
name. We don't have to do that. Just like our names are not our full names on here for our last initial.
If I'm
we don't
asking
have
for
to.
a provider's name, it's
But we
obvious.
don't have to give that.
Okay.
We don't.
She gave you the first name and spelled it and the last initial
Right.
and the title.
And if
That's
any,
all
if
we're
I'm
required
seeing a
to do.
provider, if my son's seeing a provider, it's just respectful to
She's a
be
mental
able to
health
give.
clinician. She's not a
She's not a
treating
provider.
provider. She did the evaluation. She
The
spoke
first
with
provider
you.
I had was just, she was wonderful.
Yeah, that was
Okay,
fine.
I have no problem with that, but whatever happened after that, what I have a problem, because you guys switched like a light bulb. Okay?
What switch?
She told me, she saw his she knew he had I talked to her about all his neurological problems, and she was like, yeah, he does really need help. We really wanna help you, we really are
But
gonna,
nothing
we're gonna
changed.
do
She put him
everything
on the
we
admission
can.
board, and he's still on the admission board. Nothing changed. She's not, when we think about providers, we're talking about doctors, nurse practitioners, things like that. She is not a medical provider, she's the mental health clinician like Haley and Lucy. So she's not administering any care, she just interviewed him, interviewed you, and wrote her note. So that's why they gave you the first name and the initial and the title.
And then she recommended admission.
Right, and that's what
And
we
that's
are
where he's
trying to-
still-
And admission for mental health services.
And that's still where that process is sitting.
I'm
waiting.
sorry, who are you?
I'm the patient care supervisor,
Okay, and what's your name?
Evan.
Okay. Were you the one that supposedly was gonna call me back?
I never
About
talked to you on
Haley?
the phone.
Cause nobody did.
Call you back about.
About the name, all I wanted was a name of the clinician.
You
And I
got
don't
the name of the
understand.
clinician. You got it.
It's Marbel, and her last initial's L. And she just
No, I
did
didn't get the
intake
last name.
assessment. She hasn't seen him since then, so.
I don't know what the problem is and why. It's like, what do you think I'm gonna do? Like,
We don't give out our last initial, it's our last initial on.
never
here.
heard of that. Never heard of that
That's
working in the
what
medical
we
field.
do, yeah,
I mean,
that's
The
what,
Lewis
that is
Black-
what it is.
I don't know, cause I've never worked in the ER,
The
but I
Lewis
don't know if you're
Blackman
afraid
Act
somebody's
only
gonna
applies to
like do
physicians.
something or that somebody's gonna search the, well, this is care for my son. So obviously I
understand
wanna
that.
know who's caring for him and who's doing his medical evaluation. I'm very involved.
Mhm.
And if there's something wrong with that, I guess
We're
I
not
am
saying anything-
disrespectful.
We're not saying there's anything wrong with that.
We're just explaining
You
the
saying
policy. And
I'm
she's not-
disrespectful because of that,
she's not
because I
in it.
asked her for the last name.
That's not, we're not talking about
Yeah.
that.
And
That
We-
is the conversation I had with her.
But you asked for an initial, or the last name, she gave the first name, the spelling, and the initial. That is what we give, that's it.
Okay.
So before these items, so nothing can be brought in there into your son until we look it over, and we're not gonna let you bring the whole bag in there at once. So if it's something, if you said it was the tamales, if you wanna bring those in, everything else would be left outside the room. You're not gonna be able to bring anything, just because we have other patients within that suite too, so we don't want anyone to have access to items that are brought in. Just
Okay.
like we would want, like your coat and your purse and stuff, we'll have you lock that up before you go in there.
Okay.
Okay. Alright. Any other So we have these lockers right here, you can keep them locked up with your purse and your coat in, and then the rest of the stuff, what did you want, did you want to bring home something to eat right now, is that what your goal was?
If you want some out.
Okay, so go ahead and you can, choose which locker, and then you just turn the key, and then you grab the key. And then the rest of this stuff, once you grab the tamales,